welcome once again to my channel, where we basically talk about your health. We talk about your health. In today's video, I wanted to talk about hypertension. Have you seen people getting stroke before? Yes. They can't move, they can't talk, they can't walk, they can't do anything. All because they couldn't control their hypertension. So in today's video, let's just talk about what? Hypertension. If you have any question regarding this topic, please feel free to let me know in the comment section, and I'll take my time to answer you or even do a video for you. Alright, so let's go straight into the topic. So what is hypertension? So hypertension, that means too much pressure in the vessel. It's just like the pipe, okay? When you put too much force through the pipe, we say you have what? Hypertension. And your whole body is made up of what? Pipes, meaning vessels. So when there's too much pressure in these vessels, it starts causing what? Problem. But there are two types. Sometimes we don't even know how it happened. You know, say you have hypertension. How? Where? Who gave it to me? Who gave it to me? You don't know. Okay, so hypertension without any known cause, we call it what? Primary hypertension or essential hypertension. Sometimes too, because of an underlying condition or a disease, you are having the hypertension. And those ones we call them what? Secondary hypertension. Now, hypertension is difficult to detect because normally you are working fine, you are okay, you are normal, no problem. Alright? That's you go to the hospital, you have hypertension. Where? How? We don't know. And that's because hypertension will not show unless you screen yourself. The only time it's going to show is when you're not having an organ damage or when there are now great symptoms. When I say great, it means now your major part of your body or your organs, let's say the heart, let's say the liver, let's say your kidneys are now getting destroyed. That is when it will prompt you to perhaps go to the hospital. Alright, and that's when you go to the hospital. One of the first things they do is to check your BP. They'll put something around your arm here to know your pressure or to check your BP. There's a range, okay, but I'm not going to talk about all of those because maybe you don't need it, right? Good. But basically, just know that if you go and they say that, oh, your pressure is very high, it means it's high. And you have to sit down, check it again, or later check it again before they can diagnose you of hypertension. Good. So don't wait until there's a problem before you visit the hospital to check for your pressure. At all, anybody, I bet you can do it once in a month, twice, or twice in 6 months. You can just go there randomly, just go to the health facility and just check your BP. It won't kill you. And if you have pressure, then there's a way, or if you have high blood pressure, there's a way that we have to help you to be able to tone it down or to bring it down. Some will include an exercise, your diet, so on and so forth. Alright, good. So now let's come back to what we are discussing again. So now you have pressure. After you have pressure, what are some of the things that will lead to it? Apart from the fact that it doesn't have any known cause. That's one aspect. At that time, so now we have what we call risk factors. Yes, risk factors. What will predispose you to having high blood pressure? 1, alcohol. So you like drinking? Biko, tone it down. Smoking. Biko. That's why later you come to the hospital. One of the questions we ask you under your social history is, do you drink, do you smoke? It's very important to us. But these two things can cause a lot of troubles. We don't want it. So please, always be faithful and tell us the truth. Some of you lie a lot. And I'll do a video on it. Why patients lie and why doctors get angry. Because when you lie, you don't understand why you're lying. I don't know why. You are dying when you tell the truth. Why? Repent. God is time. Alright. So, again, I talk about high blood pressure. So, 1, alcohol, smoking, and then if you are obese, you are heavy, too much fat in your system can also cause high blood pressure. There's a way to do that. I mean, all of them have their own mechanism of what? Action. But if you're not doing what they can do, so no need. Just know that if you're obese, you can get hypertension. And sometimes too, if you have a history, family history, you can also get. So someone asks you, is your mom hypertensive? Is your dad hypertensive? Is your uncle hypertensive? Is any member of your family hypertensive? Yes. So if they are, you have a chance that you can also be hypertensive. So always make sure you check. There are a lot of risk factors. Even diabetes is a risk factor. So if you have too much sugar and you have the day that you have diabetes, you can get what? Hypertension. Please, again, don't do it. Some of you don't like exercise at all. So if you follow me on my TikTok and my Instagram, you realize that every morning I try to do some exercise before I go to work or before I do anything. Alright, if I don't go for jogging, I have a mat at home, but I'll do some press ups and some stretching. They are very important. It keeps you very active. So please adapt it. It will help you. So if you don't exercise a lot, you can also get high blood pressure. So please, there are a lot of causes which I'm not able to mention everything. But if you want to talk about it for you alone, let me know. I'll give it for you just for you to talk about everything that you need to know. We have what to call the modifiable risk factors, and we have what to call the non-modifiable risk factors. Like I said, time no need. We can't go through all of those things. But pressure is not a good thing. And what happens to when you get pressure, if you don't control your pressure, is that it can start destroying your organ. That's why I said don't wait for your organ to start getting destroyed before you get to know that you have pressure. Your heart. You can have heart failure because of pressure. You can have liver failure because of pressure. You can have kidney failure because of pressure. You know the cause of dialysis? Don't let me go there. You don't want to get to that stage whereby your kidney cannot more function. Don't let me go there. But if you want me to go there, let me know in the comment section and I will hit it for you. And then what again? The brain. And that's the most common complication if you don't control your hypertension. The brain, you get stroke. Please, be cool. Don't wait till you get to that point whereby you're worried. Unfortunately, that part is numb or it's paralyzed, so you can't control that part. If you're not taking, you can't even talk, you can't even walk. Basically, you can't do anything. So you see, you become a burden to yourself, a burden to families. Maybe your child should have gone out there to look for money. Now see how the economy is so tough everywhere. Alright, okay. And now he or she has to stop and come and take care of you. Please, don't let us not get to that stage. That's why I'm advising you, I'm admonishing you that let's do our possible best to prevent these things from happening. That's why I want to be a doctor. Alright? So let me know if you have any health issue, health conditions that you might want me to help you with it. But again, the take home is that try and visit the nearby clinic and check your BP. It's free. That's not taking any money. It's free. Alright. So basically, I think that is it. If you have any question, let me know and I will digest it for you. Alright. I love you. Peace out.